Hi guys, welcome back again to Truth Be Told. It's been a while. I've been traveling, but it's good to be back. Today I want to talk about crowding. Crowding can be described in different ways. That's when teeth are malpositioned, displaced in the arch, overlapping, or they are rotated. And basically the alignment does not look pleasing. It's probably the major condition that most people associate with the need for braces or seeing an orthodontist. So we want to talk a little bit more about what crowding is all about. Crowding basically is an issue of space. There's a discrepancy between the tooth sizes and the arch size. So if the arch perimeter is a bit too small and the sum total of the width of all the teeth exceeds that, the teeth cannot fit in a proper arch form, nicely aligned. Now, if you remember in the last segment of Truth Be Told, we explained how a child will have a first set of teeth, or what we call milk teeth, or primary teeth, and there is 20 of those. And those 20 eventually shed, and they are replaced by a new set of adult or permanent teeth. And after this, there is no more replacement of teeth. And the adult teeth are 32 of them. And I explained to you the phenomena that you're talking of 20 plus 32, and that's 52 different events of teeth developing inside the jawbone and rising through into the gum and positioning themselves in the correct place in the mouth. So the chances of things not progressing perfectly or not being perfectly orchestrated is quite high. And if there is inadequate space, that complicates things even further, and that's how we then begin to see crowding, displacement of teeth, rotations, and all that. So how do we solve that? If there is no space, I've got two options. One is to reduce the amount of tooth mass per arch, which means extracting or removing some teeth, and then I end up with less teeth that I can nicely align within the jaw. The other option is I can change the shape of the arch. I can expand the arch. I can make the arch bigger and increase the perimeter so that the teeth have more space to align themselves. But now, here is the catch. Each of these approaches can affect the appearance. At the end of the day, it's not just to get the teeth looking straight. We also want the face to be in harmony, to be a pleasing appearance. We don't want the lips that maybe you've expanded, they appear like they're pouting out, and when you're smiling, even though you've got straight teeth, they'll be sticking out in the face. We don't want that. So each case has to be assessed individually. There are cases where the appearance of the face, the size of the chin, the size of the nose, the placement of the lips can easily allow us to expand without ending up with a poor facial appearance. And there are other cases where if you expand, you end up with a terrible face where teeth are sticking out and the lips are pouting. And the vice versa as well. You can end up in a scenario where the teeth and lips are all dished back, then the person looks like an old lady who has had all their teeth gone out, the old lady appearance when they have dentures. So those are the things that we need to assess. So it's very important before any treatment is rendered that we make an assessment of the shape of the face, the amount of space that is required, and which will be the best approach. Do we expand or do we extract teeth? And then we'll be able to provide the correct treatment for each person. So in terms of timing, the best time really for the orthodontist to take a look at kids is around age 7. Why age 7? This is the time when the transition starts. That's when baby teeth are lost, and then you have permanent teeth starting to replace all the baby teeth. A very interesting phenomena here. Often I have parents come to me and say, we don't understand why all these teeth are becoming crowded. When you share their baby teeth or on here, these baby teeth, they were all perfectly aligned. I don't want to see perfectly aligned baby teeth. I want to see gaps, a lot of gaps between baby teeth, because when the permanent teeth come through, they are bigger and they demand more space. If the arch was already perfectly closed with no gaps in between with the baby teeth, it obviously means that the permanent teeth are not going to fit. Contrary to what we may believe, the jaw, we don't grow into our teeth. In fact, after age 7, there's very little change in the size of the tooth-bearing area. So if the baby teeth looked all perfectly aligned, it means permanent teeth, which are bigger, won't look perfectly aligned, so there'll be crowding. So at the transition stage at age 7, we want to see every kid. And we're then able to determine who needs maybe some early intervention that will prevent complications in the future. What are some of the complications? Some teeth get blocked out of the arch completely. They get set in the jawbone. You actually end up having to do some surgery, open up and find where they are, and then begin to pull them down, which is very involved. So if we can expand the jaw while the teeth are still forming, then they can come through into the mouth much easier. Also, I talked about expanding, and sometimes we cannot expand the jaw. If we expand the jaw, we could end up with gum being stripped away, and that can compromise the support of the teeth in the long run. So in these cases, we need to start extracting teeth, perhaps much earlier in a series of extractions, sort of chasing for space every time the new teeth are beginning to come through. And that plan can be made in a timely fashion when we see the kid early, before those problems begin to develop. And then we can establish a time frame of what to do and at what point. So it's very important at age 7. It's not necessarily because the orthodontist wants to start treatment, but he wants to screen the kids and find out which ones need this special attention, which will be long running during the rest of the period of growth and development. All right, that's today's lesson. The take-home message is that crowding is an issue of space. If there isn't enough space, teeth will not be nicely aligned. So when you see signs of crowding, please contact your orthodontist so that a timely intervention can be started. Thank you. Bye.